The title of today's lecture is The Most Powerful Approach to Psychotherapy and to Life. The most powerful approach to psychotherapy and to life. So I'm addressing you as mental health professionals, psychiatrists, psychologists, social workers, marriage and family therapists, and also some here are my patients. What I'm about to present to you, I'm making a bold claim. I say this is the most powerful approach to psychotherapy. I've been in practice for over 45 years. I've been licensed as a clinical psychologist in California since 1974. I'm 74 years of age as of next month. So I bring a lot of experience to bear on this topic. And it took me many years before I said, okay, I'm ready now to present to my peers, to make a contribution to the field. Over 45 years to say, okay, I'm ready to offer this to you. And to make the bold claim as knowing the most powerful approach. Many of you have been in practice for many years. You've made valuable contributions to your clients, to your patients. You've helped them with their anxieties, their depressions, their panic disorders, their marriages, their parenting issues. You've made tremendous contributions as therapists, doing psychotherapy. People have turned to you with confidence. They're vulnerable. They come to you needing your help, and you've provided help. So within the scope of what you do, most of you have been very successful in alleviating the suffering of the people who have come to you. You've been clinicians, you've been technicians. I'm going to introduce the word holicians, somebody we're going to deal with at a holistic level as well now. Clinician, technician, holician. We're going to talk about what that means. So as a field, we've been recognized and respected in society. People have us on television shows and making comments as experts in various areas. When there's criminal activity or unusual events of one sort or another, psychologists are called in, psychiatrists are called in. There are many shows, Dr. Phil, Dr. Drew, and so forth. It's now part of the mainstream culture. One time, to see psychologists, to see a psychiatrist, to see a mental health professional was taboo, or nobody talked about these things. Now it's become mainstream. Many self-help books. So the contribution of the mental health profession has been enormous. That's not disputable. There's no question. The efficacy, a tremendous amount of research, empirically based studies, vigorous research, showing the effectiveness of various approaches, alleviating the suffering of humanity. We've achieved a lot. That being said, I can point out areas about the failure of psychology, given even with the successes. If you have a full-time practice, you see 8 people a day, if every therapist was working full-time, seeing patients 5 days a week, we'd reach just a tiny fraction of the population, maybe a few 100,000, 300,000, 500,000 people a year. Very small percentage of the total population. We have 8 billion people on the planet. Most people at various times in their lives are suffering and suffering deeply, and we're not reaching them. It's a luxury to be able to come in on a one-to-one basis, or even coming in group therapy, and talk to a trained professional. That's a luxury that most people do not avail themselves of, or can't afford, or don't wish to even initiate. So in that sense, in terms of a societal sense, we have failed. We have failed to really uplift society from the loneliness that exists in the world, the depression, the anxiety, the tremendous relationship issues, the divorce that's just rampant, the failure of the family unit, failure of marriages with a high divorce rate. We have failed to alleviate this at a really substantial level. We have to deal with that.